Hi everyone, I am Dr. Shobna, Assistant Professor, Department of Pharmacy Practice from Sri Shanmugha College of Pharmacy. Today we are going to discuss about a case on chronic renal failure, that is SOAP analysis on chronic renal failure. First, we want to know about what is meant by SOAP. Abbreviated subjective, objective, assessment and plan. In subjective, we generally say about yet patient demographics. And in objective, we see about the physical examinations and then laboratory investigations. And in assessment, a diagnosis, what we confirm the disease, and implant the treatment chart. So now we are going on to the case a chronic renal failure. In summary, a 65-year male patient admitted with the case of breathlessness for 1 month and history of insufficient urine production and history of fatigue, that is a drowsiness and malaise. Malaise means a discomfort and history of increased breathlessness on exertion. While during activity also doing some physical activities, his breathlessness increases for past 1 month. He also had a past medical history of hypertension for 5 years, which was under the treatment. Then he was diagnosed with chronic renal failure, which was confirmed by his lab investigations. Then he was treated with the diuretics, calcium channel blockers, and other supportive medications. And as the condition of the patient improved, he was discharged from the hospital. Now moving to the subjective part, we already discussed about the patient demographics, that is general things, name, age, and gender, and the complaints with the case of breathlessness for 1 month, history of insufficient urine production, and fatigue, malaise, and breathlessness on exertion. And social history, he is drinking for past 7 years, and medical history, already we said about the hypertension for past 5 years. His medication for hypertension is amlodipine 10 mg and telmisartan 20 mg. In objective part, while doing physical examination, patient was conscious, that is, he was alive and oriented while he is answering all the questions and afibrilling, he does not have any fever and pallor. Pallor means an anemic condition. In CVS, S1 and S2 sounds are here, and P by A. Stomach was soft or as respiratory sound, that is, some bilateral craft has been present. Some sign sounds was found, and CNS no next stiffness. And in vital signs, it shows normal temperature and normal pulse, and BP is already a hypertensive patient, so the BP was high. In laboratory investigations, we already showed he is a pale, that is anemic patient. So hemoglobin is low, RBC is low, and HCT is low. Why then lymphocytes are low in chronic patient? Means due to chronic inflammation in the kidney or due to the uremic toxin accumulations. So lymphocytes are low, and monocytes and eosinophils are high due to the kidney does not function properly. That means monocytes eosinophils, the uremic toxin cannot be excreted from the kidney, so monocytes and eosinophils are high. Next, department of biochemistry. In this, sodium and bicarbonate are high due to excretion of acid from the kidney are low. So it forms a low sodium and bicarbonate excretion. Next, renal profile, urea, serum creatinine and uric acid are high. Due to damaged kidneys cannot effectively filter these waste products out of body. So this urea, serum creatinine and uric acid accumulated in the body. And radiology examination is done because the patient is hypertension. So further echo report are taken. In this mild LV systolic dysfunction and LVEF equal to 45% and a trivital normal regression. And in interpretation, that is assessment, comparing subjective and objective data. Reason, the patient was admitted with the case of breathlessness, insufficient urine production, fatigue, and breathlessness on exertion. And evidence we show about the lymphocytes, RBC, hemoglobin, sodium, bicarbonate are low, and monocytes, eosinophil, serum, creatinine, uric acid, urea are high. And in diagnosis, it was confirmed that chronic renal failure, and anemic patient and also a mild LV systolic dysfunction. So the patient treatment was what? The 3 units of packed red blood cells were given and hemodialysis was done, oxygen therapy was given and other supportive measures like injection furosemide and tablet metoprolol succinate. Injection furosemide was given for reducing the edema and metoprolol succinate for reducing the BP and ranitidine for ulcer concern, amlodipine and prazosin HCl for hypertension, erythropoietin for treatment of chronic kidney disease, and iron sucrose for treatment of anemia. So same thing we discussed in the above slide. And next, while discharging on the ducts, telmisartan, amlodipine, metoprolol, these are hypertensive drugs can be given, and esomeprazole and sodium bicarbonate are ulcerative drugs, and EPO is erythropoietin used to treat the chronic. While in discharge, tablet telmisartan, amlodipine, and metoprolol, these are given for the hypertensive drug, and esomeprazole, magnesium, and sodium bicarbonate are anti-ulcer drug, and EPO is nothing but the erythropoietin drug. On pharmacist intervention, prazosin and metoprolol, while and prazosin amlodipine, by taking both, it increases the low antihypertensive. So plan for further assessment, improve lifestyle changes, control of blood pressure, restriction of fluids, salt, potassium and phosphorus and protein, avoid alcohol consumption, regularly monitor their renal functions. Alternative therapy for prazosin, a tamsulosin tablet belongs to the classification of alpha blockers. It can be used as an alternative therapy. Goal of therapy: retarding progression of renal damage, strict control of hypertension, maintaining a body weight, improve the quality of life. And patient counseling: already we told about the limiting the alcohol intake, advised the patient to perform the stress reducing activities by medications or yoga, advised to manage diabetes and high blood pressures, on body weight, and patient advised to undergo regular clinical checkup to determine the kidney functions. And drug-based counseling, the patients should took all the prescribed medications regularly. Do not skip the medication or stop the medications. Follow the instructions on the OTC medication because taking too many pain reliever for a long time could damage the kidney. On diet-based counseling, patients advised to consume the adequate carbohydrate bread, beans to provide energy, and rich in fruits, vegetables, low-fat dairies, and whole grains, fish, poultry, seeds, and nuts. And patients are advised to limit the intake of fluid and water in case of swelling. Avoid sodium-rich food, processed food, and foods containing preservatives. Avoid high potassium foods like banana, mango, coconut, water, avocado, potatoes, and milk, etc. Avoid sugary foods. These are the reference I used to take this PPT. Thank you.